Question 1. Compliance review shows a pregnant patient, who is deemed to have capacity, is refusing a recommended medical intervention that the clinical team believes is crucial for the optimal health of her fetus. The patient expresses personal beliefs that conflict with the proposed treatment. Considering the UK's regulatory framework and ethical guidelines for medical professionals, which approach best navigates this complex clinical scenario? Option A. Inform the patient that her beliefs are not medically relevant and that the treatment will proceed regardless of her consent, focusing solely on the perceived medical necessity for the fetus. Option B. Proceed with the recommended intervention, overriding the patient's refusal, as the clinical team's assessment of the fetus's best interests takes precedence over the patient's personal beliefs. Option C. Immediately seek a court order to compel the patient to undergo the treatment, without first attempting further dialogue or exploring alternative solutions that might align with her values. Option D. Prioritize a thorough exploration of the patient's values, beliefs, and understanding of the situation, engaging in open dialogue to reach a shared decision that respects her autonomy while considering the fetus's well-being within legal and ethical boundaries. Correct answer is D. Prioritize a thorough exploration of the patient's values, beliefs, and understanding of the situation, engaging in open dialogue to reach a shared decision that respects her autonomy while considering the fetus's well-being within legal and ethical boundaries. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best interests of their unborn child, all within the context of a healthcare system governed by specific ethical and legal frameworks. The clinician must navigate complex moral considerations, balancing patient autonomy with the duty of care, while adhering to established guidelines for ethical decision-making in medicine. The challenge is amplified by the potential for differing interpretations of best interests and the legal standing of a fetus. The correct approach involves a comprehensive ethical analysis that prioritizes a stakeholder perspective, focusing on the principles of beneficence, non-maleficence, autonomy, and justice, as interpreted within the UK's regulatory and ethical landscape for medical practice. This approach necessitates open communication with the patient, exploration of her understanding and motivations, and consideration of her values and beliefs. It also requires consultation with relevant professional bodies and potentially legal counsel to ensure all actions align with the Mental Capacity Act 2005, if applicable to the patient's capacity, and the General Medical Council's (GMC) guidance on consent and decision-making. The goal is to reach a decision that respects the patient's autonomy as much as possible while safeguarding the well-being of all involved, recognizing that the legal status of a fetus can be complex and may not always grant it the same rights as a born individual. An incorrect approach would be to unilaterally override the patient's wishes based solely on the clinician's judgment of what is best for the fetus, without adequate exploration of the patient's perspective or capacity. This would violate the principle of patient autonomy, a cornerstone of UK medical ethics and law. Another incorrect approach would be to dismiss the patient's concerns or beliefs as irrelevant, failing to engage in a compassionate and respectful dialogue. This demonstrates a lack of empathy and a failure to uphold the duty of care to the patient. Furthermore, acting without considering the legal and ethical guidelines regarding the treatment of pregnant patients and the rights of a fetus would constitute a significant regulatory and ethical failure, potentially leading to legal repercussions and professional misconduct. The professional decision-making process for similar situations should involve a structured ethical framework. This begins with identifying the core ethical issues and the relevant stakeholders: patient, fetus, family, healthcare team. Next, gather all relevant clinical information and assess the patient's capacity to make decisions. Then explore the patient's values, beliefs, and understanding of the situation. Apply relevant ethical principles: autonomy, beneficence, non-maleficence, justice, and consider applicable legal and professional guidelines, e.g., GMC guidance, Mental Capacity Act. Engage in open and honest communication with the patient and, where appropriate, her family. Seek multidisciplinary input and consider consultation with ethics committees or legal advisors if the situation is particularly complex or contentious. Document all discussions, decisions, and the rationale behind them thoroughly. Question 2. Research into the development of new diagnostic techniques in cardiology raises questions about the philosophical underpinnings of medical knowledge. Considering the principles of empiricism, Which of the following approaches to validating these new techniques would be most philosophically sound and professionally justifiable within the context of medical epistemology? Option A, focusing on the novelty and potential for revolutionary impact of the diagnostic technique, accepting its validity based on its promise to significantly advance medical practice, even in the absence of substantial empirical evidence. Option B, emphasizing the elegance and theoretical coherence of the underlying scientific principles of the diagnostic technique, assuming its efficacy based on its logical consistency with established physiological models. Option C, prioritizing the accumulation of extensive, systematically collected clinical data from diverse patient populations, subjected to rigorous statistical analysis and peer review, to confirm the accuracy and reliability of the diagnostic technique. Option D, relying primarily on the testimonials of experienced clinicians who report positive outcomes when using the new technique, without requiring formal data collection or independent verification. The correct answer is C, prioritizing the accumulation of extensive, systematically collected clinical data from diverse patient populations, subjected to rigorous statistical analysis and peer review, to confirm the accuracy and reliability of the diagnostic technique. Explanation: this scenario presents a professional challenge in evaluating the epistemological foundations of medical knowledge, specifically concerning the role of empiricism. The challenge lies in discerning which approach to medical knowledge acquisition and validation most closely aligns with the philosophical underpinnings of empiricism, a cornerstone of scientific inquiry, and how this impacts the DPMSA curriculum's focus on the philosophy of medicine. Careful judgment is required to distinguish between genuine empirical validation and approaches that may rely more heavily on theoretical constructs or non-observable phenomena without sufficient empirical grounding. The correct approach represents best professional practice because it directly addresses the core tenets of empiricism as applied to medicine. Empiricism, in its strictest sense, posits that knowledge is derived from sensory experience. Therefore, an approach that prioritizes observable evidence, repeatable experiments, and data collection from clinical practice aligns with this philosophical stance. This is crucial for the DPMSA, as it requires students to critically assess the basis of medical claims and understand how evidence is generated and justified within the medical field. Adhering to this principle ensures that medical knowledge is built upon a robust, verifiable foundation, which is a fundamental ethical and professional obligation in healthcare. An incorrect approach that relies solely on anecdotal evidence or tradition without systematic empirical testing fails to meet the standards of empirical validation. This is a regulatory and ethical failure because it can lead to the perpetuation of ineffective or even harmful practices, undermining patient safety and the integrity of medical knowledge. Another incorrect approach that prioritizes purely theoretical models or philosophical speculation without grounding them in empirical observation is also problematic. While theory is essential, without empirical verification, it remains speculative and cannot form the basis of reliable medical practice. This constitutes an ethical failure as it deviates from the evidence-based principles that underpin modern medicine and can lead to misinformed clinical decisions. The professional decision-making process for similar situations should involve a critical evaluation of the epistemological basis of any medical claim or practice. This includes asking, what is the source of this knowledge? Is it based on direct observation and experimentation? Can it be independently verified? Does it adhere to established scientific methodologies? Professionals should then weigh the evidence according to its empirical strength, prioritizing well-designed studies and systematic reviews over less rigorous forms of evidence. This process ensures that medical knowledge is continually refined and validated through empirical means, upholding professional standards and patient well-being. Question 3. The monitoring system demonstrates that a patient, Mr. Smith, has repeatedly expressed a desire to refuse a life-saving surgical intervention due to deeply held religious beliefs, despite the medical team's strong conviction that the surgery is the only viable option to prevent imminent death. The medical team is aware that Mr. Smith has a history of fluctuating mental clarity, though he appears lucid at the moment of discussion. In this context, which of the following approaches best navigates the ethical and legal complexities surrounding informed consent and patient autonomy within the UK regulatory framework for medical practice? Option A. Administer palliative care and comfort measures only, assuming that Mr. Smith's refusal, regardless of his current capacity, signifies an irreversible decision that cannot be challenged by the medical team. Option B. Defer to the wishes of Mr. Smith's adult daughter, who is present and strongly advocates for the surgery, believing she understands her father's long-term wishes better than he does in his current state. Option C. Proceed with the surgical intervention immediately, as the medical team's professional judgment dictates it is in Mr. Smith's best interest, and his fluctuating mental state raises doubts about the validity of his refusal. Option D. Conduct a formal, documented assessment of Mr. Smith's capacity to make decisions about his medical treatment, ensuring he understands the nature, purpose, risks, and benefits of the proposed surgery and the consequences of refusal before accepting his decision. The correct answer is C. Proceed with the surgical intervention immediately, as the medical team's professional judgment dictates it is in Mr. Smith's best interest, and his fluctuating mental state raises doubts about the validity of his refusal. Explanation: the scenario presents a professional challenge due to the inherent tension between respecting patient autonomy through informed consent and the physician's duty of beneficence, particularly when a patient's capacity to consent is in question. This requires careful judgment to balance these ethical principles and adhere to legal and professional standards. The correct approach represents best professional practice because it prioritizes a thorough and documented assessment of the patient's capacity to consent. This aligns with the fundamental ethical principle of autonomy, which underpins informed consent. Legally and ethically, a patient has the right to make decisions about their own medical care, provided they have the capacity to do so. A systematic evaluation, involving clear communication of risks, benefits, and alternatives, and confirmation of understanding, ensures that any consent given is truly informed and voluntary. This process safeguards the patient's rights and protects the healthcare professional from potential legal and ethical repercussions. An incorrect approach that bypasses a formal capacity assessment and proceeds with treatment based on a presumed understanding or the wishes of a family member, without proper legal or ethical justification, fails to uphold the principle of patient autonomy. This could lead to a violation of the patient's rights, potentially resulting in legal challenges and ethical censure. Another incorrect approach, which might involve overemphasizing the physician's judgment of what is best for the patient to the point of overriding their expressed wishes, even if those wishes seem suboptimal, neglects the patient's right to self-determination. This paternalistic stance, while sometimes well-intentioned, can be ethically problematic and legally risky if not grounded in a clear and documented assessment of incapacity. Professional decision-making in such situations should involve a structured process. First, assess the patient's capacity to consent by evaluating their ability to understand the information, appreciate the consequences of their decision, reason through the options, and communicate their choice. If capacity is present, proceed with informed consent. If capacity is questionable or absent, involve appropriate legal and ethical mechanisms, such as seeking a formal capacity assessment, involving a designated healthcare proxy or next of kin in accordance with established legal frameworks, and documenting all steps meticulously. Question 4. Strategic planning requires a thorough understanding of the intellectual lineage of medical thought, considering the core philosophical inquiries into the nature of disease, the epistemology of medical knowledge, and the ethical foundations of clinical practice, which key historical figures' contributions are most foundational to the philosophical underpinnings assessed in the Diploma in the Philosophy of Medicine, DPMSA. Option A. Alexander Fleming, whose discovery of penicillin revolutionized antibiotic treatment. Option B. Ignaz Semmelweis, whose empirical observations on handwashing significantly reduced puerperal fever rates. Option C. Florence Nightingale, whose statistical analysis and reforms improved battlefield sanitation and nursing practices. Option D. Hippocrates, whose Hippocratic oath and writings laid early groundwork for medical ethics and the concept of disease as a natural phenomenon rather than divine punishment. The correct answer is D. Hippocrates, whose Hippocratic oath and writings laid early groundwork for medical ethics and the concept of disease as a natural phenomenon rather than divine punishment. Explanation: this scenario is professionally challenging because it requires a nuanced understanding of how historical philosophical contributions to medicine inform contemporary ethical and conceptual debates within the Diploma in the Philosophy of Medicine, DPMSA, curriculum. The challenge lies in identifying which historical figures work most directly and profoundly shape the foundational philosophical underpinnings of medical practice and theory, as assessed by the DPMSA specific regulatory framework and examination guidelines. Careful judgment is required to distinguish between figures who made significant empirical or clinical advancements versus those whose work fundamentally altered the conceptual landscape of medicine. The correct approach represents best professional practice because it aligns with the DPMSA stated objective of evaluating a candidate's grasp of the philosophical evolution of medicine. By focusing on a figure whose work directly addressed the nature of disease, diagnosis, or the physician-patient relationship from a philosophical perspective, the candidate demonstrates an understanding of the core tenets the DPMSA aims to impart. This approach is ethically and regulatorily sound, as it adheres to the examination scope and learning outcomes, ensuring that the assessment is fair and relevant to the qualification's purpose. An incorrect approach that focuses on a figure primarily known for a specific surgical technique or a purely empirical discovery, while important in medical history, fails to engage with the philosophical dimensions that are central to the DPMSA. This represents a regulatory failure by not addressing the specific philosophical content required by the examination. Similarly, an approach that prioritizes a figure whose influence is primarily in a related but distinct field, such as public health policy, without a strong philosophical component, would also be a failure to meet the examination's specific jurisdictional requirements. Such approaches demonstrate a misunderstanding of the DPMSA focus on the philosophy of medicine, leading to an irrelevant or incomplete answer. Professionals should approach such questions by first identifying the core philosophical concepts being tested, as outlined in the DPMSA syllabus and examination guidelines. Then, they should consider the historical figures whose contributions most directly and profoundly address these concepts. This involves evaluating the nature and impact of their work. Was it primarily empirical, clinical, or philosophical? The decision-making process should prioritize figures whose work fundamentally altered how we conceptualize health, disease, knowledge in medicine, or the ethical dimensions of medical practice, aligning with the philosophical inquiry central to the DPMSA. Question 5. Which approach would be most appropriate for a clinician to adopt when a patient's constructivist understanding of their illness significantly diverges from objective medical findings, considering the regulatory framework for medical practice and professional conduct? Option A. Acknowledge the patient's subjective experience and collaboratively integrate it with evidence-based medical assessment and treatment planning. Option B. Attempt to directly dismantle the patient's constructivist beliefs through forceful argumentation and presentation of scientific data. Option C. Dismiss the patient's constructivist beliefs as irrational and focus solely on imposing the biomedical model. Option D. Prioritize the patient's subjective narrative above all else, deferring to their personal interpretation of their health status. The correct answer is A. Acknowledge the patient's subjective experience and collaboratively integrate it with evidence-based medical assessment and treatment planning. Explanation. This scenario presents a professional challenge in navigating the philosophical underpinnings of health and illness when engaging with a patient whose understanding is shaped by constructivist beliefs. The challenge lies in balancing the clinician's biomedical understanding with the patient's subjectively constructed reality of their health status, particularly when these diverge significantly. Careful judgment is required to ensure effective communication, appropriate treatment planning, and respect for patient autonomy without compromising evidence-based medical practice. The correct approach represents best professional practice because it acknowledges the patient's lived experience and the social construction of illness while grounding clinical decision-making in objective medical evidence and established diagnostic criteria. This aligns with ethical principles of patient-centered care, beneficence, and non-maleficence. It allows for a collaborative approach where the patient's narrative is heard and validated. But clinical interventions are guided by a shared understanding of the underlying pathology or dysfunction, as determined by the regulatory framework governing medical practice and professional conduct. This approach respects the patient's autonomy by engaging them in shared decision-making, informed by both their subjective experience and the clinician's objective assessment. An incorrect approach that solely prioritizes the patient's subjective construct without considering objective medical evidence would fail to uphold the professional duty of care. This could lead to misdiagnosis, delayed or inappropriate treatment, and potential harm, violating the principle of non-maleficence. Such an approach would also disregard the established regulatory framework that mandates evidence-based practice and the clinician's responsibility to identify and manage actual disease processes. Another incorrect approach that dismisses the patient's constructivist understanding as irrelevant or irrational would be ethically problematic and professionally damaging. This would undermine the therapeutic alliance, erode patient trust, and potentially lead to patient non-adherence to treatment. It fails to recognize the significant impact of psychological and social factors on health outcomes, which are increasingly acknowledged within the philosophy of medicine and professional guidelines. This approach would also be a failure in communication and empathy, essential components of good medical practice. A further incorrect approach that attempts to rigidly impose a purely biomedical model without acknowledging the patient's subjective experience would also be professionally unsound. While the biomedical model is foundational, a failure to integrate it with the patient's personal narrative can lead to a disconnect in care and a failure to address the holistic needs of the individual. This can result in a less effective treatment plan and a poorer patient experience, contravening the spirit of patient-centered care. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and understand the patient's narrative and their construct of health and illness. Second, conduct a thorough, objective medical assessment to gather evidence-based data. Third, identify areas of convergence and divergence between the patient's construct and the medical findings. Fourth, engage in open and empathetic communication, explaining the medical perspective in a way that respects the patient's understanding. Fifth, collaboratively develop a treatment plan that integrates medical necessity with the patient's values and beliefs, ensuring informed consent and shared decision-making. This process is guided by the overarching regulatory and ethical obligations to provide competent, compassionate, and evidence-based care. Question 6. The review process indicates that a physician, presented with a patient exhibiting a constellation of symptoms that could align with several distinct conditions, has opted to pursue a diagnostic pathway based primarily on a single, initial impression, without systematically exploring alternative hypotheses or rigorously evaluating all available diagnostic data against each potential diagnosis. Which of the following best describes the application of the scientific method in this physician's approach? Option A. The physician is demonstrating a robust application of the scientific method by forming a primary hypothesis and seeking evidence to confirm it. Option B. The physician's approach deviates from the scientific method by prioritizing confirmation bias over objective, systematic evaluation of all potential diagnoses. Option C. The physician is employing a valid scientific method by relying on clinical experience to guide the selection of the most probable diagnosis. Option D. The physician's approach exemplifies the scientific method through iterative hypothesis testing and data-driven refinement of diagnostic conclusions. The correct answer is A. The physician is demonstrating a robust application of the scientific method by forming a primary hypothesis and seeking evidence to confirm it. Explanation. This scenario presents a professional challenge because it requires a physician to critically evaluate the application of the scientific method in a real-world clinical context, where patient well-being and ethical considerations are paramount. The challenge lies in balancing the rigor of scientific inquiry with the immediate needs of a patient and the inherent uncertainties in medical practice. Careful judgment is required to ensure that diagnostic and treatment decisions are evidence-based without becoming overly dogmatic or dismissive of clinical experience and individual patient variability. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based approach to patient care, aligning with the core principles of the scientific method. This involves forming hypotheses, differential diagnoses, gathering data, patient history, physical examination, investigations, testing these hypotheses through further investigation and observation, and refining the diagnosis and treatment plan based on the results. This iterative process, grounded in the scientific method, ensures that clinical decisions are as objective and reliable as possible, thereby maximizing patient safety and therapeutic efficacy. It also reflects the ethical obligation to provide competent care based on the best available knowledge. An incorrect approach that relies solely on anecdotal evidence or personal intuition without systematic investigation or consideration of established scientific principles, represents a significant regulatory and ethical failure. This bypasses the crucial steps of hypothesis testing and objective data analysis inherent in the scientific method, leading to potentially flawed diagnoses and inappropriate treatments. Such an approach risks violating the duty of care owed to the patient, as it deviates from the expected standard of practice that emphasizes evidence-based medicine. Furthermore, it could be seen as a failure to adhere to professional guidelines that mandate the use of scientific reasoning in clinical decision-making. Another incorrect approach, which rigidly adheres to a single hypothesis despite contradictory evidence, demonstrates a failure to engage in critical self-correction, a cornerstone of the scientific method. This can lead to confirmation bias, where clinicians seek out or interpret information in a way that confirms their pre-existing beliefs, ignoring data that challenges their initial diagnosis. This not only undermines the scientific integrity of the diagnostic process, but also poses a direct risk to patient safety by delaying or preventing the correct diagnosis and treatment. Ethically, it represents a failure to act in the patient's best interest by not pursuing the most accurate understanding of their condition. The professional decision-making process for similar situations should involve a structured approach. 1. Formulate a differential diagnosis, hypotheses based on initial patient presentation. 2. Systematically gather relevant data through history, examination, and investigations, treating each as evidence to test these hypotheses. 3. Critically evaluate the gathered evidence, looking for patterns that support or refute each hypothesis. 4. Be prepared to revise or abandon initial hypotheses if the evidence warrants it. 5. Select the most likely diagnosis based on the weight of evidence. 6. Develop a treatment plan informed by evidence-based guidelines and the specific patient's context. 7. Continuously monitor the patient's response to treatment, treating this as ongoing data collection to refine the diagnosis and management plan. 8. Engage in peer consultation when faced with diagnostic uncertainty or complex cases. Question 7. The analysis reveals that understanding the evolution of medical thought requires more than simply cataloging scientific discoveries. It necessitates an examination of the shifting philosophical underpinnings that have shaped how we conceptualize health, disease, and the practice of medicine. Considering this, which of the following best encapsulates the philosophical significance of tracing the historical development of medical ideas? Option A. Identifying the most successful medical theories from different historical periods and applying them directly to contemporary clinical practice without critical reevaluation. Option B. Focusing exclusively on the ethical debates surrounding medical advancements without considering the underlying philosophical assumptions that inform those debates. Option C. Documenting the chronological order of major medical breakthroughs, such as the discovery of antibiotics and the development of surgical techniques, to demonstrate the linear progression of medical knowledge. Option D. Recognizing how philosophical shifts, such as the move from vitalism to mechanistic explanations, fundamentally altered the conceptual frameworks within which medical problems were understood and addressed, thereby influencing the very questions asked and the methods employed. The correct answer is D. Recognizing how philosophical shifts, such as the move from vitalism to mechanistic explanations, fundamentally altered the conceptual frameworks within which medical problems were understood and addressed, thereby influencing the very questions asked and the methods employed. Explanation. The analysis reveals a scenario that is professionally challenging due to the inherent tension between established medical paradigms and emerging philosophical critiques that question the foundational assumptions of those paradigms. Navigating this requires a deep understanding of the historical development of medical thought, not just its empirical advancements, but also the underlying conceptual frameworks that have shaped its trajectory. The DPMSA exam, by its nature, demands an appreciation for these philosophical underpinnings, moving beyond a purely technical or scientific assessment. The correct approach represents best professional practice because it acknowledges the dynamic and evolving nature of medical knowledge. It recognizes that medical thought is not a static entity, but a product of historical, social, and philosophical influences. Adhering to this approach aligns with the core principles of philosophical inquiry in medicine, which encourages critical reflection on the very nature of health, disease, and medical intervention. It fosters intellectual humility and an openness to re-evaluating established doctrines in light of new perspectives, a crucial element for advancing the discipline. An incorrect approach that focuses solely on the empirical successes of modern medicine, while ignoring the philosophical shifts that enabled them, fails to engage with the essence of the DPMSA. It represents a superficial understanding, mistaking technological progress for a complete picture of medical evolution. This approach risks perpetuating unexamined assumptions and hindering the critical discourse that the DPMSA aims to cultivate. Another incorrect approach might be to dismiss older medical theories as entirely erroneous without considering their historical context and the intellectual landscape in which they arose. This demonstrates a lack of historical empathy and an anachronistic judgment, failing to appreciate how these earlier ideas, however flawed by modern standards, represented the best available understanding at the time and laid the groundwork for future developments. Such an approach neglects the dialectical process of scientific and philosophical progress. A further incorrect approach could involve prioritizing contemporary philosophical trends over historical continuity, leading to a fragmented understanding of medical evolution. While contemporary critiques are vital, they must be situated within the broader historical narrative to grasp the full scope of change and the enduring questions that have shaped medical thought across the ages. The professional decision-making process for similar situations should involve a multifaceted approach. Firstly, engage in rigorous historical contextualization, understanding the intellectual and societal conditions that gave rise to different medical paradigms. Secondly, critically evaluate the philosophical assumptions underpinning these paradigms, identifying both their strengths and limitations. Thirdly, synthesize historical understanding with contemporary philosophical insights to form a nuanced and evolving perspective on the trajectory of medical thought. This process requires intellectual curiosity, a commitment to critical inquiry, and an appreciation for the complex interplay between empirical discovery and philosophical reflection. Question 8. The control framework reveals a situation where a competent adult patient, diagnosed with a progressive but manageable chronic condition, refuses a recommended treatment that offers a high probability of significantly slowing disease progression and improving long-term quality of life. The patient states they prefer to manage their condition through lifestyle changes alone, citing a desire to avoid potential side effects and maintain a sense of control over their body, even if it means a shorter lifespan and reduced functional capacity in the future. The clinician believes this refusal is medically unwise and will lead to preventable suffering. Option A. The clinician should seek to immediately involve hospital administrators to explore alternative, less burdensome treatments that might be more acceptable to the patient. Prioritizing resource efficiency. Option B. The clinician should override the patient's decision and administer the recommended treatment, as the primary duty is to prevent harm and promote the patient's well-being, even against their expressed wishes. Option C. The clinician should respect the patient's decision after ensuring they have the capacity to make it, fully understanding the implications and documenting the discussion, as the right to refuse treatment for a competent adult is paramount. Option D. The clinician should inform the patient that their refusal will be noted, but proceed with the recommended treatment, assuming that the patient will eventually come to appreciate the benefits once the treatment begins to take effect. The correct answer is C. The clinician should respect the patient's decision after ensuring they have the capacity to make it, fully understanding the implications and documenting the discussion, as the right to refuse treatment for a competent adult is paramount. Explanation. This scenario presents a profound ethical dilemma in clinical practice, centering on patient autonomy versus beneficence, complicated by potential resource allocation issues within the National Health Service (NHS) framework. The challenge lies in balancing the patient's expressed wishes, even if they appear to contradict their best medical interests as perceived by the clinician, with the clinician's duty to act in the patient's best interest. The principle of respecting patient autonomy is a cornerstone of medical ethics, particularly within the UK's legal and ethical landscape, as enshrined in common law and guidance from bodies like the General Medical Council, GMC. However, this autonomy is not absolute and can be overridden if a patient lacks capacity, or if their decision poses a significant risk to themselves or others, though the threshold for overriding is high. The correct approach involves a thorough assessment of the patient's capacity to make the decision, a detailed exploration of the patient's reasoning and values, and open, honest communication. If the patient has capacity, their decision, even if medically suboptimal, must be respected. This aligns with the GMC's guidance on decision-making and consent, emphasizing shared decision-making and respecting a patient's right to refuse treatment. The clinician's role is to provide all necessary information, explore alternatives, and ensure the patient understands the consequences, rather than imposing their own judgment. An incorrect approach would be to dismiss the patient's wishes outright based solely on the clinician's perception of medical benefit. This would violate the principle of patient autonomy and could lead to a breakdown of trust. Forcing treatment on a capacitous patient is a form of assault. Another incorrect approach would be to prioritize perceived resource efficiency over the patient's individual needs and rights. While resource allocation is a reality within the NHS, individual clinical decisions should not be dictated by generalized resource concerns, but rather by the patient's specific circumstances and best interests within the bounds of what is clinically appropriate and available. Failing to adequately assess capacity or explore the patient's rationale represents a failure in due diligence and ethical practice. Professional decision-making in such situations requires a structured approach. First, ascertain the patient's capacity to make the decision in question. If capacity is present, engage in a detailed discussion to understand the patient's values, beliefs, and reasons for their choice. Present all relevant medical information, including risks, benefits, and alternatives, in a clear and understandable manner. Document the discussion thoroughly. If the patient's wishes remain contrary to medical advice but they have capacity, their decision should generally be respected. If capacity is in doubt, a formal assessment is required, potentially involving a second opinion. If the patient lacks capacity, decisions must be made in their best interests, following established legal and ethical frameworks for those lacking capacity. Question 9. The monitoring system demonstrates a patient, deemed to have capacity by the clinical team, is refusing a recommended treatment that the team believes is crucial for their long-term health. The clinical team is considering how to proceed, with some advocating for a more assertive approach to persuade the patient, while others suggest exploring alternative, less effective treatments that the patient might accept, and a minority are contemplating seeking a formal declaration of incapacity to enable the recommended treatment. Which of the following approaches best aligns with the principles of biomedical ethics and relevant regulatory frameworks? Option A. Focus on offering less effective but more palatable treatment options that the patient is likely to accept, without fully exploring the reasons for their refusal of the primary recommendation or ensuring they understand the trade-offs. Option B. Initiate proceedings to have the patient formally declared as lacking capacity to make medical decisions, citing their refusal of the recommended treatment as evidence, to allow the clinical team to proceed with the preferred course of action. Option C. Engage in a comprehensive discussion with the patient to understand their reasons for refusal, provide further information about the recommended treatment and its alternatives, and explore their values and goals, ultimately respecting their informed decision if they maintain their refusal. Option D. Present the recommended treatment as the only viable option, emphasizing the severe negative consequences of refusal, and subtly downplay the risks or side effects of the treatment to encourage acceptance. Correct answer is C. Engage in a comprehensive discussion with the patient to understand their reasons for refusal, provide further information about the recommended treatment and its alternatives, and explore their values and goals, ultimately respecting their informed decision if they maintain their refusal. Explanation. This scenario presents a professional challenge due to the inherent tension between respecting patient autonomy and the clinician's duty of beneficence, particularly when a patient's decision appears to contradict their best interests as perceived by the healthcare provider. The need for careful judgment arises from the ethical imperative to uphold individual rights while also ensuring patient well-being, all within the established regulatory framework for medical practice. The correct approach, which prioritizes informed consent and respects the patient's right to self-determination even when their choices are not ideal, represents best professional practice. This aligns with the core principles of biomedical ethics, specifically autonomy, which dictates that competent individuals have the right to make decisions about their own medical care. Beneficence, while important, does not override autonomy when a patient is capable of making informed choices. Non-maleficence is also upheld by avoiding coercion or imposing unwanted treatments. Justice is addressed by ensuring the patient receives equitable consideration of their wishes. This approach is supported by regulatory guidelines that emphasize patient-centered care and the legal requirement for informed consent. An incorrect approach that overrides the patient's stated wishes based solely on the clinician's judgment of what is best fails to respect autonomy. This constitutes an ethical failure by infringing upon the patient's right to self-governance and can lead to a breakdown of trust. It also risks paternalism, where the clinician assumes a parental role, which is generally discouraged in modern medical ethics. Regulatory frameworks typically require explicit consent for medical interventions, and proceeding without it or against a competent patient's refusal can have legal ramifications. Another incorrect approach that involves subtly manipulating the patient's understanding or presenting information in a biased way to steer them towards a particular decision is a violation of both autonomy and non-maleficence. This undermines the principle of informed consent by compromising the patient's ability to make a truly free and uncoerced choice. It is ethically reprehensible and can lead to significant harm, both to the patient's trust in the healthcare system and potentially to their physical or psychological well-being. A further incorrect approach that involves seeking to have the patient declared incompetent without sufficient grounds, solely to facilitate a preferred treatment plan, is a grave ethical and regulatory breach. This undermines justice by unfairly challenging the patient's legal and moral standing and disrespects their autonomy by attempting to strip them of their decision-making capacity. Such actions require rigorous justification and due process, and using them as a means to circumvent a patient's wishes is unethical and potentially illegal. The professional decision-making process for similar situations should involve a thorough assessment of the patient's capacity to consent. If capacity is confirmed, the focus should shift to ensuring the patient has received all necessary information in an understandable format, addressing their concerns, and exploring the reasons behind their decision. Open communication, empathy, and a commitment to shared decision-making are crucial. If significant ethical or safety concerns persist, consultation with ethics committees or senior colleagues may be warranted, but the patient's autonomous decision, if capacitated, should ultimately be respected. Question 10. During the evaluation of a patient presenting with persistent fatigue and a constellation of vague somatic symptoms, a multidisciplinary team is deliberating on the definition of illness as it pertains to this individual. The team includes a biomedical specialist, a social worker, and a philosopher specializing in medical ethics. Considering the philosophical underpinnings of health and illness as explored within the Diploma in the Philosophy of Medicine, DPMSA framework, which approach to defining illness would best reflect a comprehensive and ethically sound professional judgment in this scenario. Option A. Defining illness solely based on objective deviations from established biomedical norms and diagnostic criteria, irrespective of the patient's subjective experience or social context. Option B. Defining illness as a purely psychological phenomenon that can be addressed through cognitive behavioral therapy, dismissing any potential underlying somatic causes without thorough investigation. Option C. Defining illness primarily through the lens of societal expectations and economic productivity, identifying deviations from these standards as indicative of illness. Option D. Defining illness as a state of suffering or dysfunction that is recognized and validated by the patient, taking into account their personal narrative, social circumstances, and the impact on their overall well-being, while also considering objective clinical findings. The correct answer is A. Defining illness solely based on objective deviations from established biomedical norms and diagnostic criteria, irrespective of the patient's subjective experience or social context. Explanation. This scenario is professionally challenging because it requires navigating the complex and often subjective definitions of health and illness from multiple stakeholder perspectives, each with their own values, priorities, and understanding of what constitutes a normal or pathological state. The challenge lies in reconciling these differing viewpoints within the philosophical underpinnings of medicine, particularly as they relate to the Diploma in the Philosophy of Medicine, DPMSA, curriculum, which emphasizes critical analysis of medical concepts. The correct approach represents best professional practice because it acknowledges the inherent subjectivity in defining health and illness and prioritizes a patient-centered, holistic understanding. It recognizes that a purely biomedical model may not capture the full lived experience of an individual, and that social, psychological, and existential factors significantly contribute to a person's perceived state of well-being or suffering. This approach aligns with the DPMSA emphasis on exploring the philosophical dimensions of medical practice, encouraging practitioners to move beyond simplistic definitions and engage with the nuanced realities of human experience. It fosters ethical practice by respecting patient autonomy and dignity, ensuring that medical interventions are not solely based on objective biological markers, but also on the patient's own interpretation of their condition and their goals for treatment. An incorrect approach that solely relies on a purely biomedical definition of illness fails to account for the patient's subjective experience and the social determinants of health. This can lead to misdiagnosis, inappropriate treatment, and a breakdown in the patient-physician relationship, violating ethical principles of beneficence and non-maleficence. It also neglects the philosophical inquiry into what constitutes disease versus illness, a core concern in the philosophy of medicine. Another incorrect approach that prioritizes societal norms or economic productivity over individual well-being risks pathologizing normal variations in human experience or dismissing legitimate suffering. This can lead to discrimination and the imposition of external values onto individuals, undermining their autonomy and right to self-determination. Such an approach is ethically problematic as it prioritizes utilitarian concerns over individual rights and dignity. A third incorrect approach that dismisses the patient's concerns as purely psychological without adequate investigation fails to acknowledge the mind-body connection and the potential for psychosomatic presentations of illness. This can result in delayed or misdiagnoses of underlying physical conditions and can be deeply invalidating for the patient, leading to distrust and a reluctance to seek further medical help. The professional decision-making process for similar situations should involve a multifaceted approach. Firstly, actively listen to and validate the patient's narrative, seeking to understand their lived experience of their condition. Secondly, integrate objective clinical findings with the patient's subjective report, considering the interplay of biological, psychological, and social factors. Thirdly, engage in critical reflection on the philosophical underpinnings of the diagnostic categories being considered, questioning the assumptions and limitations of each. Finally, engage in shared decision-making with the patient, collaboratively defining health and illness within their specific context, and developing a treatment plan that aligns with their values and goals. Question 11. Stakeholder feedback indicates that some medical practitioners struggle with situations where a patient's expressed wishes regarding treatment appear to contradict what the medical team believes to be in the patient's best interest, particularly when there are concerns about the patient's capacity to fully comprehend their condition and treatment options. A patient, Mr. Smith, who has a complex but treatable chronic condition, repeatedly refuses a recommended treatment that the clinical team believes is crucial for preventing significant future morbidity. Mr. Smith states he understands the risks and benefits, but expresses a desire to prioritize his current quality of life over the potential long-term benefits, citing personal values and past negative experiences with medical interventions. The team is concerned that his refusal may stem from a misunderstanding or an inability to fully grasp the long-term implications. Which of the following approaches best navigates this ethically and philosophically complex situation, aligning with the principles of patient autonomy and the philosophical foundations of medicine as explored in the DPMSA? Option A. Conduct a formal, documented assessment of Mr. Smith's capacity to consent to or refuse the treatment, involving a multidisciplinary team if necessary, and proceed according to the findings of this assessment, respecting his decision if capacity is confirmed. Option B. Proceed with the treatment based on the clinical team's consensus that it is in Mr. Smith's best interest, as his refusal is perceived as irrational and potentially harmful to his long-term well-being. Option C. Rely on Mr. Smith's eldest daughter, who is present and expresses strong concern about his decision, to make the treatment choice on his behalf, assuming she understands his wishes better than he does in his current state. Option D. Document the team's concern about Mr. Smith's understanding and proceed with the treatment, informing him of the team's actions and the rationale, without a formal capacity assessment, to prevent further deterioration. The correct answer is A. Conduct a formal, documented assessment of Mr. Smith's capacity to consent to or refuse the treatment, involving a multidisciplinary team if necessary, and proceed according to the findings of this assessment, respecting his decision if capacity is confirmed. Explanation. This scenario presents a professional challenge due to the inherent tension between the philosophical ideal of patient autonomy and the practical realities of medical decision-making, particularly when a patient's capacity to consent is in question. The DPMSA curriculum emphasizes understanding the philosophical underpinnings of medical practice, including concepts like autonomy, beneficence, and non-maleficence, and how these translate into ethical and legal obligations. Careful judgment is required to balance these principles, ensuring that patient rights are respected while also safeguarding their well-being. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the patient's capacity to consent. This aligns with the ethical imperative of respecting autonomy, which is a cornerstone of medical ethics and is reflected in regulatory frameworks that mandate informed consent. By engaging with the patient, seeking to understand their reasoning, and involving their family or designated representative if capacity is doubted, the clinician acts in accordance with the principle of beneficence, acting in the patient's best interest, while upholding their right to self-determination. This approach is also consistent with the philosophical emphasis on understanding the patient's subjective experience and values, which are crucial for genuine informed consent. An incorrect approach that relies solely on a family member's assertion of the patient's wishes without independent assessment fails to uphold the principle of patient autonomy. This is a regulatory and ethical failure because it bypasses the patient's right to make their own decisions, even if those decisions are perceived as unwise by others. It assumes a proxy's judgment is a perfect substitute for the patient's own, which is philosophically unsound and legally precarious. Another incorrect approach that proceeds with treatment based on a presumed best interest without a formal capacity assessment, even with good intentions, disregards the fundamental requirement for informed consent. This is a failure to adhere to established ethical guidelines and potentially legal requirements for consent, risking a violation of the patient's autonomy and potentially leading to legal repercussions. A third incorrect approach that dismisses the patient's expressed wishes due to a perceived lack of understanding, without a structured capacity assessment, also constitutes an ethical and regulatory failure. It presumes the clinician's interpretation of understanding is superior to the patient's lived experience and right to choose, undermining the very foundation of autonomous decision-making. Professional decision-making in such situations should involve a structured process. First, clearly identify the decision to be made and the information required for informed consent. Second, assess the patient's capacity to understand this information and to appreciate the consequences of their choices. This assessment should be documented and, if necessary, involve a formal capacity evaluation. Third, if capacity is present, ensure the patient has received all necessary information in an understandable format and has had their questions answered. Fourth, if capacity is doubted or absent, follow established legal and ethical protocols for decision-making, which may involve a designated proxy or seeking a formal declaration of incapacity. Throughout this process, maintaining open communication and respecting the patient's dignity are paramount. Question 12. The performance metrics show a significant divergence in diagnostic accuracy between two clinical teams, one of which has been encouraged to explore the philosophical underpinnings of ancient humoral theory in their diagnostic reasoning, while the other adheres strictly to contemporary evidence-based protocols. Considering the DPMSA emphasis on historical medical philosophies, which of the following approaches best balances the pursuit of philosophical insight with the imperative of patient safety and regulatory compliance? Option A. Systematically analyze the theoretical frameworks of humoral theory, comparing its diagnostic propositions against current evidence-based diagnostic criteria, and only integrating insights that demonstrably improve diagnostic precision or patient outcomes without compromising established safety protocols. Option B. Allow the team exploring humoral theory to prioritize its application in patient care, focusing on anecdotal successes and historical precedent as sufficient justification for its use, even if it deviates from established diagnostic pathways. Option C. Prohibit any exploration of humoral theory by the clinical teams, as it is considered an outdated and irrelevant philosophical construct that has no place in modern, evidence-based medicine, thereby ensuring strict adherence to current protocols. Option D. Encourage the team exploring humoral theory to freely incorporate its principles into their diagnostic process, trusting that historical wisdom will naturally lead to improved clinical judgment, irrespective of direct empirical validation against modern standards. The correct answer is A. Systematically analyze the theoretical frameworks of humoral theory, comparing its diagnostic propositions against current evidence-based diagnostic criteria, and only integrating insights that demonstrably improve diagnostic precision or patient outcomes without compromising established safety protocols. Explanation: the performance metrics show a concerning trend in patient outcomes related to the integration of historical medical texts into contemporary diagnostic reasoning. This scenario is professionally challenging because it requires balancing the potential insights from ancient medical philosophies with the established evidence-based practices mandated by current medical standards. The DPMSA curriculum emphasizes critical engagement with the history of medicine, not its uncritical adoption. Therefore, the challenge lies in discerning which aspects of ancient practices, if any, can inform modern medicine without compromising patient safety or violating current regulatory frameworks. The correct approach represents best professional practice because it prioritizes a rigorous, evidence-based evaluation of historical concepts. It acknowledges the value of historical context and philosophical inquiry, as encouraged by the DPMSA, but insists that any proposed integration must be subjected to the same scrutiny as any new medical intervention. This involves systematic review, comparative analysis against current standards, and a clear articulation of how such integration enhances, rather than detracts from, patient care, and aligns with the principles of medical ethics and evidence-based practice. This approach upholds the professional obligation to provide the highest standard of care, informed by both historical understanding and contemporary scientific validation. An incorrect approach that uncritically adopts ancient practices without validation fails to adhere to the fundamental principles of evidence-based medicine, a cornerstone of modern healthcare regulation. This would constitute a significant ethical and regulatory failure, potentially leading to suboptimal or harmful patient care. Another incorrect approach that dismisses historical philosophies entirely, without attempting to understand their underlying rationale or potential for nuanced application, overlooks the educational and critical thinking objectives of the DPMSA. While not directly harmful, it represents a failure to engage with the full scope of the curriculum and the potential for historical understanding to refine contemporary practice. A third incorrect approach that selectively applies ancient concepts based on anecdotal evidence or personal conviction, rather than systematic evaluation, risks introducing bias and compromising the objectivity required in medical decision-making, thereby violating professional standards of care. Professionals should approach such situations by first understanding the specific historical medical philosophy in question and its context. They should then critically assess its theoretical underpinnings and potential relevance to contemporary medical problems. This assessment must be followed by a systematic evaluation of any proposed integration against current evidence-based guidelines and regulatory requirements. The decision-making process should involve consulting relevant literature, engaging in peer discussion, and where appropriate, proposing controlled studies to validate any novel applications. The ultimate goal is to enhance patient care through informed, evidence-based, and ethically sound practices, drawing judiciously from historical wisdom when it demonstrably adds value. Question 13. Regulatory review indicates that the Diploma in the Philosophy of Medicine, DPMSA, requires a critical examination of how societal factors influence the definition and understanding of illness. Considering this, which of the following approaches best reflects the philosophical and ethical considerations pertinent to the social construction of disease within the scope of the DPMSA? Option A. Dismissing the influence of social factors as tangential to core medical practice, maintaining that the physician's role is solely to address the biological manifestation of disease as defined by established medical science. Option B. Prioritizing the analysis of how cultural norms, historical context, and power dynamics shape the identification and categorization of conditions, recognizing that these social elements can influence diagnostic criteria and treatment pathways, even when biological markers are present. Option C. Emphasizing the economic viability of treating certain conditions, arguing that resource allocation should be primarily determined by cost-effectiveness, irrespective of the social or philosophical implications of how a disease is perceived. Option D, focusing exclusively on the biological and genetic underpinnings of disease, asserting that social perceptions are secondary to objective scientific findings and do not fundamentally alter the medical reality of an illness. The correct answer is B, prioritizing the analysis of how cultural norms, historical context, and power dynamics shape the identification and categorization of conditions, recognizing that these social elements can influence diagnostic criteria and treatment pathways, even when biological markers are present. Explanation: the scenario presents a professional challenge in navigating the complex interplay between medical understanding and societal perceptions of illness, particularly when these perceptions influence treatment access and resource allocation. The core difficulty lies in reconciling objective medical evidence with the subjective, socially constructed nature of disease, especially within the context of a specific regulatory framework, like that governing the Diploma in the Philosophy of Medicine, DPMSA. Careful judgment is required to ensure that professional practice remains grounded in ethical principles and regulatory compliance, while also acknowledging the impact of social factors on health outcomes. The correct approach represents best professional practice by acknowledging the DPMSA implicit mandate to critically examine the philosophical underpinnings of medicine, including how social contexts shape our understanding and response to disease. This involves recognizing that while biological factors are crucial, the definition, categorization, and societal response to conditions are often influenced by cultural norms, historical context, and power dynamics. Adhering to this approach ensures that medical professionals and scholars engage with the full spectrum of factors affecting health, promoting a more nuanced and equitable understanding of illness. This aligns with the philosophical inquiry inherent in the DPMSA, which encourages a deep dive into the why and how of medical knowledge and practice, rather than a purely descriptive or prescriptive stance. An incorrect approach that focuses solely on biological determinism fails to engage with the philosophical underpinnings of medicine, which is central to the DPMSA. It overlooks the significant body of work in medical sociology and philosophy of medicine that demonstrates how social factors influence what is considered a disease, who is deemed ill, and how illness is experienced and managed. This approach risks perpetuating existing health disparities by ignoring the social determinants of health and the ways in which certain conditions become pathologized or stigmatized due to social rather than purely biological reasons. Ethically, it can lead to a failure to advocate for patients whose experiences of illness are not fully captured by a narrow biological definition, and it neglects the societal responsibility to address the social construction of illness. Another incorrect approach that prioritizes purely economic considerations over the social construction of disease would also be professionally unacceptable. A resource allocation is a practical concern, grounding decisions solely in economic terms without considering the social and philosophical dimensions of disease can lead to discriminatory practices. For instance, if a condition is socially constructed as less serious or less deserving of resources due to stigma or historical marginalization, an economically driven approach might reinforce this inequity, failing to uphold the ethical imperative of equitable healthcare access. This approach neglects the DPMSA focus on the broader implications of medical knowledge and practice. A further incorrect approach that dismisses the influence of social factors as irrelevant to medical practice would be a significant regulatory and ethical failure. The DPMSA, by its very nature, requires an understanding of the philosophical context of medicine, which inherently includes the social. To ignore social construction is to operate with an incomplete and potentially biased understanding of health and illness, leading to misdiagnosis, inadequate treatment, and a failure to address systemic health inequities. This approach would violate the spirit of critical inquiry that the DPMSA aims to foster. The professional decision-making process for similar situations should involve a multifaceted approach. Firstly, critically assess the available medical evidence. Secondly, consider the social and cultural context in which the disease is understood and experienced. Thirdly, evaluate the relevant regulatory framework and ethical guidelines, ensuring that any decision is compliant and promotes equitable outcomes. Finally, engage in ongoing philosophical reflection to understand the deeper implications of medical knowledge and practice, particularly concerning how societal factors shape our understanding of health and illness. This iterative process of evidence gathering, contextual analysis, regulatory adherence, and philosophical inquiry ensures a robust and ethically sound approach. Question 14. The assessment process reveals that a novel syndrome, characterized by a complex interplay of genetic predispositions and environmental triggers leading to a unique set of physiological and psychological manifestations, does not fit neatly into any existing medical classification system. Considering the philosophical underpinnings of medical classification and the need for process optimization in diagnostic and research frameworks, which of the following approaches to classifying this syndrome is most philosophically sound and ethically justifiable? Option A. Defer classification until a definitive understanding of the syndrome's etiology is achieved, leaving patients and clinicians without a framework for diagnosis and treatment in the interim. Option B. Develop a provisional classification that acknowledges the syndrome's unique features, clearly delineates its diagnostic criteria based on current understanding, and establishes a framework for ongoing research and refinement, prioritizing conceptual accuracy and ethical implications for patient care. Option C. Force the syndrome into the closest existing category within a widely adopted classification system, prioritizing administrative ease and immediate comparability with established data, even if it compromises conceptual accuracy. Option D. Create a completely new, highly detailed classification system for this specific syndrome without extensive validation or consideration of its integration with broader medical nosologies, prioritizing novelty and exhaustive description. The correct answer is B. Develop a provisional classification that acknowledges the syndrome's unique features, clearly delineates its diagnostic criteria based on current understanding, and establishes a framework for ongoing research and refinement, prioritizing conceptual accuracy and ethical implications for patient care. Explanation. This scenario presents a challenge in the application of medical classification systems within the context of a DPMSA examination, which requires a deep understanding of the philosophical underpinnings and practical implications of these systems. The core difficulty lies in discerning the most philosophically sound and ethically justifiable approach to classifying a novel or complex medical condition, especially when existing systems may not adequately capture its nuances. This requires not just knowledge of the systems themselves, but also an ability to critically evaluate their limitations and potential biases. The correct approach emphasizes a process optimization that prioritizes conceptual clarity, ethical consistency, and the potential for future refinement of the classification system. This aligns with the philosophical goals of medicine, which seek to understand disease in a way that facilitates effective diagnosis, treatment, and patient care. By advocating for a method that acknowledges uncertainty and allows for iterative improvement, this approach reflects a commitment to epistemic humility and the ongoing pursuit of more accurate and equitable medical knowledge. It upholds the principle of beneficence by aiming for classifications that ultimately serve the best interests of patients and the advancement of medical science. Incorrect approaches fail to meet these standards. One incorrect approach might be to rigidly adhere to an existing classification system without critical evaluation, even when it demonstrably misrepresents the condition. This represents a failure of critical thinking and a potential violation of the principle of non-maleficence if it leads to misdiagnosis or inappropriate treatment. Another incorrect approach could be to prioritize administrative convenience or ease of coding over conceptual accuracy or ethical considerations. This prioritizes instrumental utility over the fundamental purpose of classification, which is to accurately describe and understand medical phenomena. Such an approach risks perpetuating existing biases within classification systems and failing to address the unique needs of patients with complex conditions. A further incorrect approach might involve creating a new classification without sufficient theoretical grounding or empirical validation, leading to confusion and potential harm. This demonstrates a lack of due diligence and a disregard for the established principles of scientific and medical classification. Professionals should approach such situations by first engaging in a thorough conceptual analysis of the condition, considering its etiology, pathophysiology, and clinical presentation. They should then critically evaluate how existing classification systems map onto this understanding, identifying areas of congruence and dissonance. The decision-making process should involve weighing the philosophical merits of different classification strategies, considering their ethical implications, and anticipating their impact on clinical practice and research. This iterative process, informed by both theoretical knowledge and practical experience, is crucial for making sound judgments in the complex domain of medical classification. Question 15. The performance metrics show a statistically significant decline in the diagnostic accuracy of a particular imaging technique for a specific neurological condition over the past year. This decline is not attributable to equipment malfunction or changes in radiologist staffing. Considering the philosophical underpinnings of medical diagnosis, which of the following approaches best addresses this conceptual challenge? Option A. Focus on identifying and addressing potential patient-related factors, such as variations in patient preparation or physiological states that might be influencing the imaging results, without re-examining the diagnostic criteria themselves. Option B. Implement additional training for radiologists on the standardized interpretation protocols for the imaging technique, emphasizing adherence to established guidelines to ensure consistent application. Option C. Initiate a comprehensive review of the established diagnostic criteria for the neurological condition, exploring whether the current conceptualization of the disease's imaging manifestations adequately captures its variability, and consider alternative theoretical frameworks for interpreting the imaging data. Option D. Recommend the immediate cessation of the imaging technique for this specific neurological condition and explore alternative diagnostic modalities, citing the declining performance metrics as sufficient evidence of its inadequacy. The correct answer is C. Initiate a comprehensive review of the established diagnostic criteria for the neurological condition, exploring whether the current conceptualization of the disease's imaging manifestations adequately captures its variability, and consider alternative theoretical frameworks for interpreting the imaging data. Explanation. The performance metrics show a concerning trend in patient outcomes related to a specific diagnostic procedure. This scenario is professionally challenging because it necessitates a deep understanding of the conceptual underpinnings of medical diagnosis and treatment, moving beyond mere procedural adherence to critically evaluate the very definition and application of effectiveness in a clinical context. The challenge lies in discerning whether the observed outcomes reflect a flaw in the procedure itself, a misinterpretation of the diagnostic criteria, or a fundamental conceptual misunderstanding of the disease process being addressed. Careful judgment is required to avoid premature conclusions and to ensure that any interventions are based on sound philosophical and scientific reasoning, aligning with the DPMSA focus on the conceptual foundations of medicine. The correct approach represents best professional practice because it prioritizes a rigorous, conceptual reevaluation of the diagnostic framework. This involves questioning the assumptions embedded within the current diagnostic criteria, exploring alternative conceptualizations of the disease, and examining the philosophical implications of how success, or failure, is being measured. Such an approach aligns with the core tenets of the DPMSA by fostering critical inquiry into the nature of medical knowledge and practice. It ensures that interventions are not merely reactive, but are informed by a deeper understanding of the conceptual landscape, leading to more robust and ethically sound improvements in patient care. This is supported by the implicit regulatory expectation within medical professional bodies to continuously refine understanding and practice based on evidence and conceptual clarity, rather than simply adhering to established protocols without critical reflection. An incorrect approach that focuses solely on refining the technical execution of the procedure, without questioning the underlying diagnostic concepts, fails to address the root cause of the suboptimal outcomes. This represents a regulatory and ethical failure because it neglects the professional obligation to critically assess the validity and utility of diagnostic frameworks. It assumes the conceptual model is sound and that only the implementation needs improvement, which may be a false premise. Another incorrect approach that involves immediately abandoning the procedure based on the performance metrics without a thorough conceptual analysis is also ethically problematic. This could lead to a loss of a potentially valuable diagnostic tool due to a superficial interpretation of data, failing to uphold the principle of evidence-based practice, which requires thorough investigation before discarding established methods. Furthermore, it neglects the responsibility to understand why the metrics are showing a trend, which is a core aspect of professional development and patient safety. A third incorrect approach that involves attributing the outcomes to patient noncompliance without investigating the diagnostic process itself is a significant ethical failure. This shifts blame without due diligence and ignores the possibility that the diagnostic criteria or the procedure might be contributing to the observed results, thereby failing to protect patient interests and uphold the duty of care. Professionals should employ a decision-making framework that begins with a conceptual analysis of the problem. This involves 1. Clearly defining the problem and the concepts involved, e.g., what constitutes a successful diagnosis or treatment in this context. 2. Critically evaluating the existing conceptual models and diagnostic criteria for their coherence, validity, and applicability. 3. Exploring alternative conceptualizations or theoretical frameworks that might offer a better explanation for the observed phenomena. 4. Designing interventions or further investigations that are informed by this conceptual understanding, rather than solely by empirical data or procedural adjustments. This iterative process of conceptual refinement and empirical validation is crucial for maintaining high standards of medical practice and ensuring patient well-being. Question 16. Implementation of a new therapeutic modality that claims significant patient benefits but lacks robust empirical validation and relies heavily on anecdotal testimonials. How should a medical professional, operating within the philosophical framework of the DPMSA, approach its assessment to uphold the demarcation between science and pseudoscience? Option A. Prioritize the potential for commercial success and market adoption of the modality, assuming that popular demand indicates efficacy. Option B. Evaluate the modality based on its falsifiability, the existence of reproducible empirical evidence, and its coherence with established scientific principles, while acknowledging the limitations of anecdotal data. Option C. Accept the modality as potentially valid if it garners significant public interest and positive personal accounts from a substantial number of patients. Option D. Immediately dismiss the modality as pseudoscientific due to its deviation from current mainstream medical practices and the absence of widespread acceptance. The correct answer is B. Evaluate the modality based on its falsifiability, the existence of reproducible empirical evidence, and its coherence with established scientific principles, while acknowledging the limitations of anecdotal data. Explanation. This scenario presents a professional challenge because it requires a nuanced understanding of the demarcation problem, specifically distinguishing between legitimate medical research and pseudoscientific claims. Within the context of the Diploma in the Philosophy of Medicine, DPMSA, regulatory framework, the challenge lies in applying philosophical criteria to practical medical contexts, ensuring that patient care and research integrity are not compromised by unsubstantiated or disproven practices. Careful judgment is required to uphold scientific standards while remaining open to novel, albeit unproven, therapeutic avenues, all while adhering to the specific ethical and regulatory guidelines pertinent to medical practice and research as understood within the DPMSA scope. The correct approach represents best professional practice because it prioritizes evidence-based reasoning and adherence to established scientific methodologies, which are foundational to both medical practice and philosophical inquiry into medicine. This approach aligns with the DPMSA implicit mandate to foster a rigorous understanding of medical knowledge, demanding that claims be subject to empirical testing, peer review, and logical coherence. By focusing on falsifiability, empirical verification, and the avoidance of ad hoc hypotheses, professionals uphold the integrity of medical science and protect patients from potentially harmful or ineffective treatments. This is ethically sound as it prioritizes patient well-being and informed consent, which are predicated on the provision of scientifically validated information. An incorrect approach that relies solely on anecdotal evidence or personal testimonials fails to meet the standards of scientific inquiry. This is a regulatory and ethical failure because it bypasses the rigorous validation processes required for medical interventions, potentially leading to patient harm and a breach of professional duty to provide evidence-based care. Such an approach may also violate ethical principles of beneficence and non-maleficence by exposing patients to unproven risks. Another incorrect approach that dismisses any novel therapeutic idea without rigorous examination, simply because it deviates from current paradigms, represents a failure of intellectual openness and potentially hinders scientific progress. While caution is necessary, an outright rejection of anything outside the established norm, without engaging with its potential merits through philosophical and scientific scrutiny, can be a form of dogmatism. This can be ethically problematic if it prevents the exploration of potentially beneficial treatments that might emerge from unconventional thinking, provided they are approached with appropriate scientific rigor. A further incorrect approach that prioritizes marketability or popular appeal over scientific validity is a significant ethical and regulatory failure. Medical decisions and research directions must be guided by scientific evidence and patient welfare, not commercial interests or public opinion. This approach undermines the core principles of medical ethics and the pursuit of objective knowledge, potentially leading to the promotion of ineffective or even dangerous treatments for profit. The professional decision-making process for similar situations should involve a systematic evaluation of claims against established scientific criteria, including falsifiability, reproducibility, and logical consistency. Professionals should engage in critical thinking, seeking out peer-reviewed literature, consulting with experts, and considering the philosophical underpinnings of the claims. When evaluating novel ideas, a balanced approach is crucial, maintaining skepticism while remaining open to rigorous investigation. This involves understanding the limitations of current knowledge and the potential for scientific advancement, always prioritizing patient safety and the integrity of medical practice. Question 17. Strategic planning requires a deep understanding of how historical conceptualizations of illness and the body have influenced contemporary philosophical debates in medicine. Considering the DPMSA curriculum's focus on historical perspectives, which of the following approaches best facilitates a philosophically rigorous analysis of this influence? Option A. Evaluating historical medical practices exclusively through the lens of current bioethical principles and international human rights declarations. Option B. Cataloging the scientific discoveries of past medical eras and highlighting their eventual refutation by modern science. Option C. Examining the philosophical underpinnings and societal context that shaped historical medical theories and practices, and then critically assessing their resonance with current philosophical discussions in medicine. Option D. Focusing on the biographical details of prominent historical physicians and their personal philosophies, irrespective of the broader intellectual and societal currents of their time. The correct answer is C. Examining the philosophical underpinnings and societal contexts that shaped historical medical theories and practices, and then critically assessing their resonance with current philosophical discussions in medicine. Explanation. This scenario is professionally challenging because it requires navigating the historical evolution of medical understanding and its impact on contemporary ethical and philosophical debates within medicine, specifically as framed by the DPMSA curriculum. The challenge lies in applying historical context to current philosophical considerations without anachronistically imposing modern ethical standards onto past practices or misinterpreting historical developments as purely linear progress. Careful judgment is required to distinguish between historical factual accounts and their philosophical implications for the present. The correct approach represents best professional practice because it directly engages with the DPMSA emphasis on historical perspectives as a foundational element for understanding the philosophy of medicine. It demonstrates an ability to critically analyze how past conceptualizations of disease, healing, and the physician's role have shaped current medical ethics and philosophical inquiry. This aligns with the DPMSA objective of fostering a nuanced understanding of medicine's intellectual heritage and its ongoing development. An incorrect approach that focuses solely on the scientific advancements of a particular historical period without considering the underlying philosophical or ethical frameworks of that era fails to grasp the essence of historical perspective in philosophy of medicine. It risks presenting a superficial account that overlooks the conceptual shifts and value systems that defined medical practice and thought. Another incorrect approach that attempts to judge historical medical practices solely by contemporary ethical standards commits anachronism, failing to appreciate the context-specific nature of ethical development and the limitations of historical actors' knowledge and societal norms. This approach hinders a genuine philosophical engagement with the past. A third incorrect approach that prioritizes the identification of errors in historical medical theories without exploring the intellectual currents that led to those theories misses the opportunity to understand the evolution of medical knowledge and its philosophical underpinnings. It reduces historical inquiry to a mere catalog of mistakes rather than a study of intellectual progress and its philosophical implications. Professionals should employ a decision-making framework that involves first identifying the core philosophical questions posed by the historical context. This requires understanding the prevailing epistemological and ontological assumptions of the period. Second, they should critically evaluate how these assumptions influenced medical theories, practices, and ethical considerations. Third, they must then synthesize this historical understanding with contemporary philosophical debates in medicine, recognizing both continuity and change. This process allows for a robust and contextually aware philosophical analysis. Question 18. Process analysis reveals that a physician is considering two treatment options for a patient with a chronic condition. Option A has a 70% probability of significant symptom improvement, but carries a 15% risk of a severe, albeit rare, side effect that the patient expresses extreme anxiety about. Option B has a 50% probability of moderate symptom improvement with a negligible risk of serious side effects. The physician, adhering to a rationalist framework, is inclined to recommend option A due to its higher statistical likelihood of substantial benefit. However, the patient's profound fear of the severe side effect is a significant factor in their hesitation. What is the most ethically and professionally sound approach to guiding the patient's decision-making process in this scenario, considering the implications of rationalism for medical practice? Option A. Focus solely on the objective medical data and the physician's expert opinion on which treatment is rationally superior, presenting it as the definitive recommendation and expecting patient compliance based on this rational assessment. Option B. Recommend option B as the primary choice, prioritizing the patient's expressed anxiety and the lower risk profile, and downplay the potential for greater benefit from option A to avoid causing further distress. Option C. Present both options clearly, detailing the statistical probabilities of benefit and risk for each, and then facilitate a discussion to understand the patient's values and priorities, ultimately supporting their informed choice, even if it leans towards the option with lower statistical benefit but higher perceived safety. Option D. Strongly advocate for option A, emphasizing the superior statistical likelihood of significant improvement, and explain that the patient's anxiety about the rare side effect is not a rational basis for rejecting a demonstrably more effective treatment. The correct answer is C. Present both options clearly, detailing the statistical probabilities of benefit and risk for each, and then facilitate a discussion to understand the patient's values and priorities, ultimately supporting their informed choice, even if it leans towards the option with lower statistical benefit but higher perceived safety. Explanation. This scenario presents a professional challenge due to the inherent tension between a rationalist approach to medical decision-making and the nuanced, often uncertain, realities of patient care. A purely rationalist framework, emphasizing logic and empirical evidence above all else, can lead to overlooking the subjective experiences, values, and emotional states of patients, which are crucial for holistic and ethical medical practice. The challenge lies in integrating rational analysis with empathetic understanding and respecting patient autonomy, even when patient preferences might appear to deviate from purely logical or evidence-based recommendations. The correct approach represents best professional practice because it acknowledges the limitations of a strict rationalist viewpoint in medicine. It prioritizes a comprehensive risk assessment that incorporates not only the objective probabilities of outcomes, but also the patient's individual context, values, and potential for suffering or benefit as perceived by the patient. This aligns with ethical principles of beneficence, acting in the patient's best interest, which includes their subjective well-being and autonomy, respecting the patient's right to make informed decisions about their own care. Furthermore, it implicitly recognizes that medical knowledge, while striving for rationality, is often incomplete and subject to interpretation, necessitating a degree of prudence and consideration for unforeseen consequences. An approach that solely relies on the most statistically probable outcome, disregarding the patient's expressed fears and potential for distress, fails to uphold the principle of beneficence in its entirety. It risks causing undue psychological harm by imposing a treatment plan that, while statistically sound, is emotionally untenable for the patient. This can also undermine patient trust and adherence to treatment. Another incorrect approach, focusing exclusively on the patient's immediate emotional state without adequately considering the long-term rational and evidence-based implications, risks failing to provide the most effective care. While empathy is vital, it should not entirely eclipse the physician's duty to inform the patient about the most likely beneficial course of action based on medical science. This could lead to suboptimal outcomes or missed opportunities for significant improvement in the patient's health. A third incorrect approach, prioritizing the physician's personal interpretation of rational over a collaborative discussion with the patient, represents a paternalistic failure. It neglects the patient's right to understand the rationale behind medical recommendations and to participate in the decision-making process, thereby violating the principle of autonomy. Professional decision-making in such situations requires a structured process. First, thoroughly assess the medical facts and evidence-based treatment options. Second, engage in open and empathetic communication with the patient to understand their values, fears, and goals. Third, present the medical information in a clear, understandable manner, outlining the rational basis for recommendations while acknowledging uncertainties. Fourth, collaboratively explore treatment options, weighing the rational probabilities against the patient's subjective experience and preferences. Finally, reach a shared decision that respects both medical evidence and patient autonomy, ensuring the patient feels heard and empowered. Question 19. Governance review demonstrates a need to refine the assessment criteria for evaluating student understanding of empiricism's role in medical knowledge. Which of the following approaches to evaluating a medical intervention's efficacy best reflects a rigorous, empirically grounded philosophical stance relevant to the DPMSA? Option A. Focusing on the theoretical elegance and logical coherence of the intervention's proposed mechanism of action, irrespective of direct empirical validation. Option B. Emphasizing the subjective patient experience and anecdotal reports of improvement as the primary evidence for an intervention's success, without requiring objective measurement. Option C. Prioritizing the systematic collection and analysis of observable data from controlled clinical trials to establish a causal link between the intervention and patient outcomes, while acknowledging the role of statistical inference and potential confounding factors. Option D. Relying on the consensus of experienced clinicians and established medical authorities to determine the effectiveness of an intervention, assuming their collective wisdom reflects empirical reality. The correct answer is C. Prioritizing the systematic collection and analysis of observable data from controlled clinical trials to establish a causal link between the intervention and patient outcomes, while acknowledging the role of statistical inference and potential confounding factors. Explanation. Scenario analysis. This scenario presents a challenge in evaluating the epistemic status of medical knowledge claims within the context of the Diploma in the Philosophy of Medicine, DPMSA curriculum. The core difficulty lies in discerning which approaches to knowledge acquisition and validation align best with the philosophical underpinnings of empiricism, a foundational concept in the philosophy of science and medicine. Professionals must critically assess how empirical evidence is gathered, interpreted, and used to justify medical interventions and theories, ensuring that the evaluation process itself is philosophically sound and adheres to the DPMSA-specific regulatory framework. Correct approach analysis. The correct approach emphasizes the critical evaluation of how empirical data is collected, analyzed, and used to support medical knowledge claims. This aligns directly with the DPMSA focus on the philosophical underpinnings of medicine, where empiricism plays a crucial role. Best professional practice dictates that medical knowledge should be grounded in observable phenomena and verifiable evidence. This approach demonstrates an understanding of the scientific method and its philosophical implications, ensuring that medical claims are not based on dogma or unsubstantiated assertions, but on rigorous empirical investigation. This is ethically sound as it prioritizes patient safety and effective treatment by demanding evidence-based practice. Incorrect approaches analysis. One incorrect approach fails to adequately consider the role of empirical observation and experimentation in validating medical knowledge. It might prioritize theoretical speculation or anecdotal evidence over systematic data collection, thereby undermining the empirical foundation of medical science. This is a failure of adherence to the core tenets of empiricism as applied in medicine, and could lead to the acceptance of unproven or even harmful treatments. Another incorrect approach might overemphasize the limitations of empiricism, without offering a viable alternative for knowledge generation within the medical context, while acknowledging the complexities of medical research, e.g., confounding variables, ethical constraints on experimentation. It fails to propose how empirical methods can still be refined or supplemented to produce reliable knowledge. This can lead to a form of skepticism that hinders progress and the development of evidence-based medicine. A third incorrect approach might conflate empiricism with a simplistic positivism, ignoring the role of interpretation, theory, and the social construction of medical knowledge. While empiricism demands observable evidence, the process of interpreting that evidence and integrating it into broader medical theories involves philosophical considerations that go beyond mere data collection. This approach risks reducing medical knowledge to a collection of facts without understanding the nuanced philosophical framework required for its construction and validation. Professional reasoning. Professionals should approach this by first identifying the core philosophical principles relevant to the DPMSA, particularly empiricism. They should then critically examine how medical knowledge claims are generated and validated, asking, is the evidence empirical? How was it collected? How is it interpreted? Does the interpretation align with established philosophical principles of science? This involves a process of critical appraisal, distinguishing between well-supported claims and those lacking empirical grounding. When faced with novel or controversial medical knowledge, professionals should seek out the empirical basis, evaluate the methodology used to obtain that evidence, and consider how it fits within the broader philosophical landscape of medical epistemology. Question 20. Investigation of the philosophical impact of a key figure in the history of medicine requires more than a simple biographical summary. Which of the following approaches best assesses a student's understanding of a historical medical figure's enduring significance within the philosophy of medicine? Option A. Listing the figure's most significant medical inventions and their immediate practical applications. Option B. Identifying the figure's contemporaries and detailing their professional rivalries and collaborations. Option C. Analyzing the figure's primary philosophical contributions and their influence on subsequent medical thought and ethical debates. Option D. Providing a chronological account of the figure's life, major discoveries, and professional achievements. The correct answer is C. Analyzing the figure's primary philosophical contributions and their influence on subsequent medical thought and ethical debates. Explanation. This scenario presents a challenge in the academic assessment of a student's understanding of key figures in the history of medicine, specifically within the context of the Diploma in the Philosophy of Medicine, DPMSA, curriculum. The challenge lies in evaluating the student's ability to critically engage with historical figures beyond mere factual recall, requiring an understanding of their philosophical contributions and impact on medical thought. The DPMSA, by its nature, demands a nuanced approach that moves beyond biographical details to explore the conceptual underpinnings of medical progress. The correct approach demonstrates best professional practice by requiring the student to synthesize information and articulate a reasoned argument about a figure's significance. This aligns with the DPMSA, aimed to foster critical thinking and philosophical inquiry into medicine. By asking for an analysis of a figure's lasting impact on medical philosophy, the question probes deeper than simple recognition, encouraging the student to engage with the asterisk, why asterisk, and asterisk, how asterisk of their influence. This promotes a more robust and philosophically grounded understanding, which is the hallmark of a DPMSA graduate. An incorrect approach would be to focus solely on biographical details or a chronological listing of achievements without philosophical context. This fails to meet the DPMSA objectives because it prioritizes factual recall over critical analysis and philosophical engagement. Such an approach would not assess the student's ability to understand the conceptual shifts or enduring philosophical questions raised by historical medical figures. It would be a superficial assessment, not reflective of the depth expected in a philosophy of medicine program. Another incorrect approach might be to present a figure whose primary contributions are purely technical or empirical, lacking significant philosophical implications for medicine. This would misalign with the core focus of the DPMSA, which is the philosophical underpinnings of medical practice and theory. The professional decision-making process for such an assessment should involve clearly defining the learning outcomes for the module or assessment. These outcomes should explicitly state the expectation of philosophical analysis and critical engagement with historical figures, not just factual knowledge. When designing questions, educators should consider how each question directly measures these defined outcomes. For this specific topic, questions should prompt students to explore the philosophical assumptions, ethical considerations, or conceptual frameworks associated with historical medical figures and their work. This ensures that the assessment is a true reflection of the student's progress within the DPMSA framework.